Hello guys, my name is Dr. Deepak Aanjna, currently doing internship at FMGE Medical College Indore. In today's video, we'll talk about success story of Dr. Gemi. Dr. Gemi, can you please introduce yourself?
Hi everyone, my name is Dr. Gemi. I'm a foreign medical graduate from Georgia. I did my mbbs from New Vision University and I cracked my June 2021 FMGE exam with a score of 270. And yeah, I'm from Tamil Nadu. That's it.
Okay. So, first of all, congratulations, Dr. Gemi, on scoring 217. And there is lot of struggle you faced during your preparation. Like I've seen your YouTube video and how in COVID time also you faced so many problems in your family too. And then also you scored so well. So congratulations and thank you so much for joining. So at least we can help.
Thank you so
our
much for the
FMGE.
opportunity, doctor. Thank you so much.
So can you please tell me before, like when you were in Georgia, so how you started your preparation that time?
Okay, I started my preparations when I was in my fifth year. My fifth year was final year. It was just a 5 year course. At the time, I used to be like on and off. Sometimes I used to study, and some other times I just used to focus on my academics. It was not a full on preparation, I would say. But I was supposed to give my December 2020 exam, but due to COVID travel restrictions, I could not reach India. So I had 6 months in my hands. So I used it for my revisions.
Okay. So means you completed your major chunk of main reading in December only, till December only.
Yes.
Okay. So when you reached India after December, I guess. So like you have to give December exam, but unfortunately you didn't got that chance. So
Yes.
you will be depressed that time. So
Of
how
course,
you?
I was so much depressed because all this hard work that I had been put for all these 6 months was it went in waste. So I was so much depressed and I couldn't sink in this idea of studying for 6 more months. That was the most difficult part, but I somehow managed it.
Yeah, totally agree. I can relate to this. And then after December, you came to India. So what major changes you did in your preparation after December 20? And what was your strategy for those 6 months or 5 months?
Um, till December, I never used to solve a lot of MCQs because I was more focused on revising my notes again and again. I had no enough time. So, because I had 6 months left, I started solving a lot of MCQs and I started giving a lot more mock tests so that they gave me more confidence, I would say.
Hmm. Okay. Means more revision and more MCQs you show.
Yes.
Yeah. So what is the role of revision and role of MCQ in exams like FMG exam? Because I think every person have their specific strategy for revision. How you revised in those 6 months, and how many revision you did?
Studying, yeah, I had around 4 revisions, I would say, and studying something is important, but what is more important than that is revising it again and again. Studying subject for once and then going to exam is just it equals to studying nothing, and you won't be able to recall everything. So revisions are more important, and they say at least you should give 3 revisions before your exam.
Yeah, totally. Because if you study 5 subjects one time, then better to once study one subject at 5 times.
Yes.
So that will give
Yes.
you more output. Yes. And I seen your video recently, video on YouTube that what situation you went through in that COVID time. Your father admitted in hospital that time, just before exam, just 2 weeks before exam. So how you managed through in that time, and then also you scored so well, like 217. So how you went through that time? Can you please tell something?
Yes, exactly 3 weeks before my exam, everybody in my family got affected with COVID, and my father got extremely sick, and we had to admit him in a government hospital. His saturation dropped down to 70%, and it was such a difficult situation for me as well as my family members. And of course, you won't be able to study with so much going on around you and your father in hospital. It was so depressing, but what helped me to achieve this score was the hard work that I gave in my previous days. even when I had so much of unexpected situations surrounding me at the last moment, the hard work that I gave in my previous days helped me to achieve this goal.
Okay. Means whatever preparation you did till the COVID situation and also before December also because you stayed so well in your college time.
Yes, that was the only thing that gave me hands at the last moment.
So what was your main motivation source for exam? Like every exam needs some motivation. What was your motivation source?
Yes. The word FMGE was itself a big motivation for me because there is so much of buzz happening around the FMGE. People say that only 15 to 20% of students appearing every time crack the exam. I was like, what's the big deal about this FMG? Everybody is afraid of FMG, so I must give in my 100% and try to become a topper in the exam. And of course, my parents' happiness and to make them proud is what we are living for, right? So that was also my big motivation.
So are you a first doctor in your family or already someone there?
Yes, first generation doctor.
So that's why their motivation is like a different level when you are the first one in the doctor.
Yes.
Same goes for me. I was the first doctor in my village, so I can relate to your situation totally. So you prepared everything from prep better, right? Like there are so many conversation like people now in Gautam Nagar, like you studied from your home, but like it's 70-80% people study from Gautam Nagar, Delhi. But what they do, like mainly many students like this coaching is best, this one is best, this one is best. So like how you use your prep ladder and other sources also, what you want to tell?
Okay, I started with prep ladder lectures. I used to watch the lectures and take my own handwritten notes because I was so fast in writing. That helped me a lot. And for revisions, I used Unacademy free videos. I did not even subscribe to Unacademy. I just watched their free videos. They were very much helpful. It gave me a lot of confidence. After I started solving a lot of MCQs, I gained that confidence. So I think it's important to use prep ladder as well as Unacademy.
Okay. So what was the role of grand test and FMG championship? How often you gave and what was your score in starting and how much you improved?
Yeah, I never really gave grand tests when I started my preparations. During the last 6 months, I started giving mocks, and it used to be like once in a month, and then finally towards the exam, it was twice or thrice in a month. And my mock started off with 150. I was so much confident that I would cross 180 plus at least. But when I saw the result, it was just 150. And that, helped me analyze that, I had to work much more harder and I had to concentrate on my weaker subjects. So giving mocks is very, very important. It helps you to analyze where you went wrong, and, it gives you a chance to rectify all the mistakes that you do.
So in your starting first mock, you scored 150, right?
Yes, 153.
Yeah. I don't think that score was bad actually. So I just want to clarify here because after this video, maybe some people will get demotivated because majority of students will get around 120, 130 in first mock or maybe below that. So nothing to worry. Like when I scored 125 before 2 months of exam, and before 1 month of exam, I scored 145. So I never go above 150. And then in exam, I scored 180. Okay. So don't worry, guys. Nice. If you are not scoring more than 150 or 150, if someone is scoring 130 above in preparator test, then he will pass definitely. He or she definitely will.
Yeah, pass. It's really difficult. I agree.
Yeah. And how was your school and college days? Like Dr. Gemi was topper in school, college too?
No. When I was in my 10th standard, I was school first, and then the graph went down and down. During my 12th standard, I scored decent, but it was not enough to get a medical seat in India. That's why I went abroad. And in my university, I would say that it used to be like sometimes in certain subjects like derma and medicine, I was so interested in all those subjects. So I used to attend all the lectures, and I used to be very interactive during lecture times. But in other subjects like anat and physiology, I used to bunk a lot. I was just an average student. It was not that I was a topper
some
all the time.
subjects you are like topper and some are like average.
Yeah.
Okay, so how's your experience with abroad MBBS? Like any advice you want to give those students who want to study in abroad, like the first year student, or like how? What was your experience?
Yeah. Yeah. My experience was like not so good, I would say, because there was not much clinical exposure in Georgia. I don't know about other countries. Maybe in Russia and China there might be good clinical exposure, but in Georgia it was not like that. We had limited patients exposed to us, and um, yeah, that was the only drawback. And also, some lecturers, they find it difficult to. I'm not blaming anyone. They might have so much of knowledge in their minds, but to express it to the students, they find it very difficult. So I had a really hard time coping with all those situations. But only thing that would help you is self-study. You have to be ready to do your own studies, and you should not depend on others for anything. If you're a student like that, you can go abroad.
Yeah.
My first advice is to try your best to get a seat in India. If not, you can go abroad.
Yeah, and that problem is not only for Georgia. Like I done from Kyrgyzstan, many of my friends in Russia, China, but I think situation is same in like every country except India. If you are going, if you are going for Bangladesh or Nepal, then maybe situation is different. But like then any other country, the situation is same. There is no clinical exposure at all. Only limited clinical exposure, even because there are some problem with patient who patient also are not comfortable with our and their language issue also. Yeah. So whatever, like you done your MBBS from there, and like then you come to India, then you like pass successfully FMG. Till now, with your experience, what advice you want to give to those preparing for FMG December 2022 or June?
Okay.
This December 2021 and June 2022.
Okay, for people who are preparing for December 2021, I would say this is the time for you to revise then, rather than studying the new concepts. Just try to revise whatever you have learned and focus on solving more MCQs. I always keep saying this, that solving MCQs, the aim is not just to get the correct answer, but to rectify your mistakes and focus on the discussion part more. That is what will help you to revise your material and to analyze your performance. So solve more MCQs and start giving mocks now, because we have just 3 months left for the exam.
Yes.
Don't be worried, because only the basic concepts will be asked. So try to focus on the repeated questions and try to solve the previous year's question papers. You can do it. And for people who are preparing for June 2022, try to study more, try to learn everything in detail.
Sure. So like those students who are still in med school, like second year, third year, fourth year, and I guess many of them are not so serious about exams next. Like in my college, seniors told that it is only like 4-month exam, 5-month exam, you will go and you will pass. But practically we see the situation. What is the situation here? Like only 15 to 20% students are passing. So what message you want to tell to those students, those who are currently in med school?
So for people who think that you can crack the FMG exam by studying for 6 months or 12 months, the story is not like that. You have to work really hard, and it takes a lot of pressure. So don't postpone anything to the last moment. Try to, start your FMG preparations from your first year onwards, I would say. I know it's too early, but trust me, try to focus on the important topics which are being asked in the NBE pattern questions. And at the same time, you can also focus on your academics. Just try to have an idea of the important topics which are being asked, and try to, invest more time on those things, and try to build your concepts. It's very important to learn everything and to learn why you're learning something. Like, if you're studying something, just ask the questions like why you're doing this and how the patient will present to you in future. If you build your concepts, it would be easier for you. And it's never like that if you can study for 6 months, you can crack FMG. You can pass the exam, but it would be really hard to, further go in our lives. We are doctors, so we must build our concepts well. That's it.
So and also about like next exam, there are many students are very worried about next exam, worrying about next exam. So can you please tell something for that?
Yeah, the concept is going to remain the same, right? If no matter if it is FMGE, NEET, PG, or next anything may come, the concept is going to be remain this is going to be the same. So don't be afraid. Just try to, and also the topics will be more or less the same. It's not that the exam is going to be entirely different. So try to start preparing rather than trying to postpone the exam, your preparations to the last moment. Try to start early and try to read the concepts and topics which are being asked in FMG. I think that would be more than enough.
Okay. And what is your future plan? Like now you're about to start your internship, right?
Yeah.
Then what is your plan?
My future plan, my aim is to become, is to get an MD in Ops Gynae. I don't know what the future holds. So let's see. I'm going to work hard and that's it.
And
Rest
also,
is in God's hand.
tell us about your YouTube channel. Like, you started your YouTube channel, and I personally feel, because there are so many FMG students, they passed exam and they just continue their internship, and like they never told anything to student. But I feel so happy, like people who pass exam and they start YouTube channel and they guide some people, because already we need so many doctors to help other FMG, because see, situation is very dangerous for those people who are not passing from 5 attempts, 6 attempts. So if we can help them, it is like good. So please tell about your YouTube channel.
Okay, I passed my FMG, and I had around 5 months. In Tamil Nadu, it takes around 5 months to start an internship. So I thought, why waste time? And I thought of helping my fellow foreign medical graduates. And also, there are only limited YouTubers for FMG, right? There are only limited people available on internet to guide our students. So I thought, let's just start a YouTube channel. And it's been 2 months, and the response is amazing. I've been posting videos about the study plan and strategy and study tips and everything. People who are interested can come join me. And I must mention this. Thank you, Dr. Deepak, for starting the YouTube channel. Especially your internship series were very much helpful, because in every state the guidelines are different, and you have been doing an amazing job. Thank you so much.
Thank you so much for joining, Dr. Gemi, and thank you for accepting my invitation. Hope this video will help to our students, those who are preparing for December, and or future students. Thank you so much. Goodbye.
Thank you, doctor. It's my pleasure.